Good morning, students. The last point in communication comes as the patient teaching or health education. Patient teaching is the teaching given to enhance the specific learning of the patient. Patient teaching is a creative, interpersonal experience differ from the other forms of teaching by the client or in the relationship. Definition of patient teaching. Patient teaching is a process involves teaching the patient about reducing the health risk factors, increasing the client's level of wellness and taking specific protective health measures. Role of the nurse in patient teaching. Nurse is to identify the client's learning needs. Second, motivate the client. Involve the client actively. Topic of the client teaching should match with the client's need. Teaching should be simple to complex. She should provide peaceful environment while teaching. And she should observe the emotional and physiological needs. The nurse should be knowledgeable with confidence. Purpose of patient teaching or health education: to promote health, to protect health, to maintain health, to identify relevant healthcare needs of clients, to provide psychological support during the teaching learning process, and to keep the nurse knowledgeable, and to raise the self-confidence of the nurse in teaching. So, in order to fulfill these goals, it is the responsibility of the nurse to educate the patient appropriately and successfully in order to receive understanding from the patient. To do so, there is some imperative or important components the nurse need to consider before following through the teaching process. They are prerequisite or preliminary assessment of patient education. First, before even starting educate the patient, the nurse must always assess the patient to see what type of environment will be most beneficial for them to be factors that may interfere. Second, another component is to consider about the environment is appropriate lighting, temperature and furniture. Along with comfort, it is important to always assess the patients for any pain before proceeding. Pain would interfere with my patient's necessary level of strength in order to perform learned skills and distract them from learning material. Also, she should be well rested in order to stay alert and fully engaged in discussion for maximum learning. The patient should always be assessed for coordination and sensory acuity as well as in order for them to perform certain motor skills and receive and respond to messages being taught. Lastly, the nurse must be taken into consideration their condition and how it may interfere with the learning process. Guidelines for effective patient teaching or health education include development and maintenance of rapport between nurse and client is very important. Time for delivering teaching should be client's convenience. Nurse should have all communication skills. Local language should be perfectly used. Use of ABAs foster learning and grabs the client attention. Teaching with demonstration is effective. Repetition is necessary in teaching process. And active involvement of nurse and client is very important. Importance of teaching. Why we need to teach the patient. Provide patient teaching as an important independent function of the nurse. As a client has the right to know, right to information. Giving information regarding client's health status is mandatory nowadays. So, patient teaching improves the nurse-client relationship. It helps the patient a safe transition from one level to another. It helps the client to make decisions about his health condition. Process of patient teaching. Process of patient teaching refers to the steps you follow to provide teaching and to measure learning. These steps involved are assessing the learning needs, developing the learning objective, planning and implementing patient teaching, evaluating patient teaching, documenting the patient teaching and learning. Role of nurse in patient teaching. When focusing on a patient's learning needs, before we begin the teaching process, we must ask a number of questions and perform specific assessment. It's important to determine her readiness and ability to learn. Second, the first thing that we must ask is if she is willing or able to accept the reality of her illness, which my patient state she is. Next step we should need to be to introduce the teaching plan. In order to provide an effective teaching plan, we must consider the developmental and physical factors of the patient. For the patient, we assess her to make sure she was able to read and write. This will make the learning process much easier, allowing her to understand and apply the things she is learning. Another consideration we need to take her age. Since my patient is an elder, the best teaching approach will be short sessions and make sure that she involved in discussion. According to Lecroix, to decrease the frustrations in learning process, information should be given in easy to understand format since the learner's attention wane after only 10 minutes. Next, we have to consider physical capability. is an obstacle for my patient because she is morbidly obese and limited movement. So in order to her to learn, we think it should be more beneficial to use a cognitive or visual method rather than a psychomotor method. Finally, after all these components are evaluated, you have taught the patient the material needed. We must evaluate what they have learned. As stated by Holler, to assess what our patient have learned and determine whether he needs more teaching, ask open-ended questions or have him explain what he has learned. Then we can evaluate what the patient is absorbed, what he needs more work. Thank you. Thank you for listening.